The direct study was hugely important, and it came about by a conjunction of really three things. Two people, me and my old pal Roy Taylor down in Newcastle, and we've known each other since the day we qualified and started practice in medicine in the same hospital. That was in Edinburgh long, long ago. But more importantly, it came at a time when a survey was carried out amongst people living with diabetes by Diabetes UK, which asked them, what would you like us to do in research? We're doing all research to try and help people, but we've never actually asked people with diabetes what they want. So that survey, which was led by Sarah Finer and included people with diabetes who were, Paul Robb was one of the co-authors of that, who himself had type 2 diabetes. They went and asked large numbers of people, what do you want us to do in research? And they said with one voice, number one priority, we want to know if it's possible to get a cure or remission. And they used the word remission of type 2 diabetes. And how do we do it? So I had been making observations myself over many years, and I'd done some research long ago into fat accumulation in specific organs. So I kind of knew vaguely what was happening, or even quite precisely what was happening. And my colleague Roy Taylor had also seen patients, some of them, lose weight and get clear of their diabetes. Now, we were both told in very succinct terms, these were rare, odd, unusual cases, and that everybody else would just continue to have diabetes and it would be progressive. And I said, no, I don't think so. I think if we lose enough weight, we can actually get on top of this disease. And Roy Taylor had agreed with this, and he'd done a small study looking at some mechanisms around what happens to the insulin function during weight loss. So we got together, we designed a plan with the help of people with diabetes. Paul Robb himself was one of the steering committee. And we said, right, we will take ordinary people with type 2 diabetes quite early in the first 6 years, so not leaving it long enough to cause really serious damage. 6 years from diagnosis, we will then say to them on day one, stop taking your medication, both for your blood pressure and for your diabetes. So we're going to get them both sorted by losing weight. So on day one, stop those medications and start on a low-calorie diet, 850 calories a day, which is a lot less than you normally eat, but not sort of critically low, not impossibly low. We're going to use a formula diet because that's what people said that they preferred to use, but you could use food-based approaches. The difficulty with using food was that people get tempted into having a bit more and a bit more and a bit more. So to keep it clean and simple, we said, right, we'll use a formula diet for the first 12 weeks and then move on to a food-based diet, which is affordable and simple, using ordinary foods, but in the right amounts to try and maintain that weight loss long term. And people did it. The GPs were doubtful. They said, oh, but the patient, if you stop their blood pressure tablets, won't their blood pressures go up again? And the answer was no, they didn't. They fell instead, because weight loss is a much more potent treatment for hypertension than any medication we have. The diabetes doctor said, oh, but most of our patients won't get better. No, almost 9 out of 10 were free from their diabetes if they lost 15 kilograms, 2 stones in weight. So it was an outrageous success. And the health services had said, if 20% of our patients can get a remission, freedom from diabetes at 1 year, we have to start changing how we look after this disease. In fact, we got almost 50%. Not everybody managed to lose weight, sadly, but those who did got free from the disease. And so within a very short time, the National Health Services in Scotland and in England and Wales and then Northern Ireland, all the separate health services put into place a plan to offer remission of diabetes as early as possible in the course of the disease. And since that time, we've managed to follow people up for up to 5 years and show that their general health improved. They had less hospital admissions for various things. They had less complications of diabetes within the 5 years if they got a remission. And other people have now started to do research on the back of this, and they've shown that there are less heart attacks and less deaths in people who are able to lose weight and get remission of their diabetes. These are big observational studies elsewhere. So I think what we've done is to upend the paradigm, the model of what we thought type 2 diabetes was, to understand that it's actually a manageable, reversible, if you like the word, disease. We can get it into remission by substantial weight loss.